What's going on, guys? Ed here. Today we're going to be talking about Anavar. I'm helping you guys to get big, strong, healthy so we can all make good choices in the weight room before we get started. If you guys like the videos I've been putting out, make sure you like, comment, subscribe, all that good stuff. We're going to get into Anavar. What is it? How does it work? What do we use it for? How do we use it? All of that good stuff. I'm going to hit you with a lot of information, and I'm going to hit you with it quick. So pay attention, get your notebooks out. Anavar, what exactly is it? Well, it's called Anavar. The actual name is oxandrolone if you look up the scientific medical compound, whatever. But yeah, today we're going to call it Anavar. So what is it? Well, it's an anabolic and androgenic steroid. It is a 17-alpha alkylated DHT derivative. 17-alpha alkylated pretty much just means it was developed as an oral steroid to pass through your liver and get metabolized by your body that way. DHT derivative, that's just one of the categories of steroids. You got your DHT derivatives, your testosterone-based derivatives, your nandrolones. We're not going to get into that today. That's for a separate video. But yeah, just know that Anavar is a 17-alpha alkylated DHT derivative. It was developed to help recovery of burn patients, to help treat bone pain, and it's prescribed for various situations to combat catabolism, where your body will actually break down quicker than it can recover. It happens if you have all different types of diseases or post-surgery. You know, your body might break itself down and you need some help to stop your body from literally eating itself. So Anavar is good for that. That was one of the things it was developed for. It also has one of the most mild side effect profiles of all the steroids. That's why it's very popular for beginner, intermediate, advanced, all the way up. It's used by both men and women because it's well tolerated in the body. So women can use this one as well. So how's it work? Well, like I said, we take it orally. Usually it comes in a tablet form. You can also find it in a liquid form. They all do the same thing. But it's a pretty versatile drug. You can use it for bulking, cutting, recomp. It's really going to be good for anything. But I would recommend that you take this with a testosterone base because it will suppress your body's natural testosterone. You don't want to run into low test side effects while you're running Anavar. This is in the case of men. Women's going to be a little bit different. I assume most people watching this video are going to be guys looking into their first couple steroid cycles. So if you're a guy and you want to take Anavar, I would recommend you take it with a test base. As always, you want to max out your natural potential first before you really get into this stuff. Just because, like, it's not really the cheat code that everybody thinks it is. Everybody thinks they're just going to take steroids and look great, when that's not the case. You got to have your diet in check. You got to have your routine, your exercise. You got to have all that stuff down first. Max out your natural limits, and then from there, you can use this as a stepping stone to the next level. But Anavar is going to do great at improving your lean body mass. It's going to help with strength. It will, in a way, kind of reduce body fat and increase vascularity, not directly, but it will help with making you to appear leaner, more vascular, more dried out, hard looking, if that makes sense. It's going to help with recovery, allow you to work out more often. You'll be able to get workouts in more frequently, work out longer, harder, stronger than you did before. And it's also much safer on the liver than a lot of other steroids, which is a good benefit for us. We'll get into that in a second. But first, let's talk about some side effects of Anavar. Like I mentioned earlier, it has one of the more mild side effect profiles. But some of the things that you want to watch out for, I guess if you're a girl taking this, is the symptoms of masculinization. You will become kind of more manly when you get on this stuff. You can expect acne, increased hair growth, voice changes, stuff like that. Like I said too, it will suppress your body's natural testosterone, so always take this with a test base and make sure you PCT after your cycle. Anavar is not as brutal on the cholesterol as most other steroids. So that's kind of one thing that's good. It's not going to really affect your cholesterol that bad. It won't wreak havoc on your LDL and send your levels skyrocketing. So you don't have to worry about that as much, but still keep an eye on it. Not that it's healthy for the heart, but it's a healthier option than most other steroids out there. Regardless, though, it can still increase your blood pressure. So make sure, keep an eye on your blood pressure, do your cardio, watch your sodium intake, all of the things that you should be doing normally to keep your blood pressure in check. Despite it being a 17 alpha alkylated steroid that's supposed to be metabolized by your body orally after passing through the liver, this actually isn't as hard on your liver as most other oral compounds because of the fact that Anavar is also metabolized by the kidneys. So it's a little bit easier on the liver, but it's kind of a double-edged sword here because now you're going to increase your renal inflammation and your kidneys are going to be acting harder to process this drug. So a little less on the liver, a little more on the kidneys. They're going to kind of split the burden there. You can help to reduce any stress on the liver by taking it sublingually. If you have a tablet or a dropper, just let it sit under your tongue for a minute or two before you kick it back and swallow it. It'll absorb into the blood vessels in your mouth, under your tongue, in your cheek. It'll get into your body quicker that way. It won't have to get metabolized through the liver as much because your body's going to absorb it right into the blood vessels there. It's a good way to combat a lot of that stress on the organs. So yeah, how do we take this? Typically, you're going to take it not like crazy long. Like if you're going to take a longer steroid cycle, say 15, 16 weeks, you're going to do Anavar maybe in the beginning to kick off your cycle, maybe towards the end, but you would kind of stick around 8 to 10 weeks max. You don't really want to go longer than like 10 weeks just because of that increased stress on your liver, your kidneys. I mean, liver not so much, but anyway, you don't want to be on this for too long because that's where especially if you're a woman, that's where the side effects are going to kind of stick in. Like if you're going to have a voice change, it's going to get deeper. It's going to stick after 10 weeks, but you come off it a little earlier than that, things will go back to normal, is what I'm saying. So don't stay on this stuff too long. There's data showing the half-life approximately 8 hours. That's the time it takes for the concentration in your body to reach 50%. We just look at half-life to see how often we want to dose it. So with a half-life of 8 hours, you would want to dose this stuff twice a day, depending on how high of dose that you're taking. Typical dose for a beginner cycle, if you're a man, is about 25 milligrams. A typical dose is going to be anywhere 25 to 50 milligrams. For a more kind of beginner, intermediate, advanced cycles, people are going up to 100 milligrams a day. I'm running Anavar right now. This is my first time ever trying it out, and I'm only taking about 15 to 20 milligrams per day, only on lifting days. So I'm not taking it on the days when I'm not lifting. It gives my body a little bit of a break, helps reduce that stress. That is one way. I guess if you want to, you could run it a little bit longer if you are taking a few days off every week on your off days. So I have it in a liquid form. I take it sublingually. I let it absorb under my tongue for a minute before I kick it back. 15 to 20 milligrams pre-workout. Sublingually, it will absorb quicker. That's why I take it pre-workout. I get the benefits during my workout, which is when I kind of want them. I want that increased pump. I want that strength gain. So I might try and kick it up a little bit, maybe 25 or so milligrams for these next few weeks. Because as of right now, I feel like I don't notice a huge effect from the Anavar. That being said, I mean, it's going to work. It's just I can't tell, like, wow, this is a major difference. So maybe I think my dosage is just too low right now, but my first time trying it out, I wanted to see what a low dose would do, so now we can start titrating up from there. The only thing that I do notice, as far as like side effects, which might be coming from the Anavar, is my voice sometimes singing is kind of not where it usually is. So I don't know if my voice is like getting deeper or like more raspy or something. Might not be from the Anavar, might be from something else. Maybe I just lost my voice or something weeks ago and it just hasn't returned. I don't know. Anyway, that's enough for today. I'm going to keep it short and sweet. If you guys have any questions, post them below. Thank you for watching. Take care. Until next time.